Okay, if you're one of the, millions of women who just dread that time of the month, you know exactly what I'm talking about. The mood swings, the bloating, the fatigue, it's a whole thing. And you've probably scrolled through a sea of so-called miracle cures online, right? But what if one of the most effective solutions was also one of the simplest? Today, we are going to cut through all that noise and look at the hard evidence. So let's just get right to it. Can a simple mineral like calcium actually make a real difference with PMS? I mean, the wellness world is full of promises, so let's skip the anecdotes and see what the actual clinical data has to say. First things first, what does the science say? Let's take a look at the clear verdict from medical research. And the verdict is in. This isn't some fringe idea from a random blog. We're talking about the Cleveland Clinic, stating pretty clearly that calcium can improve PMS symptoms. This is a recommendation backed by solid evidence from real studies. So yeah, the medical community is pretty confident on this one. And the impact? It's huge. We're talking about a potential symptom reduction of nearly 50%. Think about that. Studies show that with about 1,000 to 1,200 milligrams of calcium every day, women can get this kind of relief by their third cycle. That's not just a little improvement, that is a game changer. And this isn't just about cramps or one or two little things. A major meta-analysis confirmed that calcium works across the board. It significantly reduces those tough mood-related issues like depression and anxiety, and the physical stuff like water retention and pain. It helps with the whole shebang. Now, here's a really important distinction we need to make. For what we think of as typical mild to moderate PMS, calcium is considered a first-line defense. But for the much more severe PMDD, it is not a replacement for medication like SSRIs. Instead, you can think of it as a valuable adjunct therapy, which basically means it's a great helper that works alongside other treatments to help manage those symptoms. So we know it works, but the big question is, why? How can a simple mineral do all this? Let's dive into that fascinating brain-body connection. Well, the most compelling theory is all about serotonin. You've probably heard of it. It's your brain's feel-good chemical. What research suggests is that when your calcium levels are low, it can mess with hormones that in turn suppress serotonin. And that dip is what can lead directly to those classic PMS symptoms of irritability, moodiness, and cravings. It's a chain reaction. Okay, but why does this happen at that specific time of the month? It all comes down to something called the luteal phase. That's the 2 weeks leading up to your period. For women who get PMS, their blood calcium levels can actually drop during this phase, creating this temporary deficiency. So supplementing just helps bridge that gap, stopping that hormonal cascade before it even starts. And you know, we absolutely cannot talk about calcium without mentioning its essential partner, vitamin D. Seriously, think of them as a team. You can take all the calcium you want, but without enough vitamin D, your body just can't absorb it properly. They work so much better for our menstrual health when they're taken together. All right, that's the science, that's the why. Now for the practical part, let's build your action plan, a simple, clear blueprint for how you can actually use this information. The very first thing to know is the magic number. The huge majority of successful clinical trials used a daily dose of 1,000 to 1,200 milligrams. This is the sweet spot, the therapeutic window you really want to aim for. Now, the best approach is always food first. Your body is just better at absorbing nutrients from whole foods. So think dairy, fortified plant milks, sardines, those are fantastic. Oh, and a quick pro tip, while spinach has calcium, it also has these things called oxalates that block absorption. So leafy greens like kale are actually a better choice for getting that calcium into your system. If you find you do need a supplement to hit your target, the type you choose really matters. Calcium carbonate is super common and affordable, but it needs stomach acid to be absorbed, so you have to take it with food. Calcium citrate, on the other hand, is a bit gentler on the stomach and you can take it anytime. That makes it a much better choice if you have any digestive issues. Now, listen up, because this is probably the most common mistake people make. Your body physically cannot absorb more than about 500 milligrams of calcium at one time. So if you take a single 1,000 milligram pill, you're literally not getting the full benefit. The best strategy? Split your dose. Take 500 with breakfast and another 500 with dinner. That way you maximize your absorption. And finally, let's talk about safety and expectations. Because calcium is powerful, it's really important to use it correctly and know what to expect. First off, more is not better. The National Institutes of Health sets the upper limit at 2,500 milligrams a day. Going above that doesn't give you more PMS relief. It just increases your risk for other health issues, like kidney stones. So please stick to that 1,000 to 1,200 milligram range. This is also super critical to know. Calcium is a binder. That means it can literally grab onto other medications in your stomach and stop them from working. So if you take thyroid medication, certain antibiotics, or even iron supplements, you absolutely must separate them from your calcium dose by at least 4 hours. Finally, let's be realistic about expectations. Calcium isn't like a painkiller. It's a preventative nutrient. You might feel a slight difference in the first month, sure, but the real noticeable improvements in your mood and bloating, those typically show up after 2 to 3 full cycles of consistent daily use. You have to be patient and stick with it. So, what's the ultimate takeaway from all of this? Calcium for PMS isn't just some wellness trend. It has a level A medical recommendation. That means it's supported by the highest quality of scientific evidence we have. It is, without a doubt, one of the most effective, accessible, and safe natural tools available. So, are you ready to see the difference for yourself? The real power here is in your own personal evidence. Here's your next step, your challenge. Start a simple tracking system for the next 3 months. Just note your mood and physical symptoms, and you might just be amazed by what your own data shows you.